Hello and welcome to Clinical Time Management. This is one of the nursing videos that I have created for 183 so that you can get some tools and some ideas on how to manage your time appropriately in the clinical area. I hope that this will be useful. In the past I did have a video that I had done for a workshop. It was with the LVNs. But this time I'm going to do it with a PowerPoint, and hopefully this will be useful for you. Okay, so let's get started. First off, why should we even talk about clinical management of time? Well, that's pretty obvious, isn't it? Right now you're taking care of one patient, and perhaps you're doing very well with it, and perhaps you're not. Some of you have some past experience having worked as CNAs or worked in waitressing or in any kind of a job that has to do multitasking. And that has helped you to be able to do the job that you need to do on the floor. But getting used to all the different things, in each semester we add more things that you need to do so that by the time you graduate from our program you are prepared to handle 4 to 5 patients on the floor on an acute care setting. Of course, not all of you will go into the acute care hospital setting, and so you'll have to modify your time management. But I'm hoping that this format that I'm using will help you to identify what you have to do in a day and how to slot it out. This is what works for me. Every nurse has different things that work for them. So I recommend that you look at the floor nurses and you see what they're using, what they're doing. The problem is that most of us as floor nurses, we've been doing it for so long that we don't even know how we originally got there. It happens. And so when you ask us to articulate how we plan our day, we don't really know how to say that to you. And so what's most important, I think, as a student is that you realize, first off, it doesn't magically happen. It took time for them to get that good at what they do. Also, it requires you to watch them and to see how they do it, and don't be surprised if they can't articulate how they do it. But unfortunately, most nurses, they learn from trial and error, and I'm hoping with this tool that we're working with today that I can kind of minimize that amount of trial and error. That's way too painful. So what the point of this PowerPoint is to help you improve your time management. It will improve with time and experience. It's not something that magically happens with one little PowerPoint or with one discussion. It requires you to continually be experiencing and putting yourself in a position where you're having to push your limits. You're going to have to, at the end of the day, I really will encourage you, as you hear from me through clinical, always to reflect at the end of the day. Always look at what went right and keep it. What didn't go right, lose it, change it, figure out what you needed to do differently, and ask other people so that they can help you, because other people have a different perspective and perhaps can help you through this. And then, of course, observation. That's watching other nurses, how they do it, and stealing any little tips and tricks that they have, as long as we always maintain patient safety and security and confidentiality. So let's look at the time grid. Well, first off, my time grid is task-driven. Some people won't like that, but this is the one that I'm going to throw out to you, and then you can go from there. What I basically do is I identify the tasks that are needed for each patient. I identify the time that these tasks must be done, and then I slot those tasks into the appropriate times, and I use that tool throughout my day. And I do have a handout that is attached to this PowerPoint that hopefully you've already printed out. If not, you might want to do that right now so that you can look at this time grid and go along with me as we work through this. I like this little squirrel here, where he has too many things to do. My day is packed. That's how you feel as a nurse. We have so many things to do. Sometimes I wonder why I ever got into a career that has so many things to do, but I really do like to have a full day, and the day goes so fast. But it is nice when you have some breathers. My time grid is so what's the right word? Just sealed into my brain that I don't need to have a piece of paper that says, okay, what do I do at this time? What do I do at that time? Because I know that I should be sitting down at a certain time doing my charting. I know that if I don't have my morning care done by a certain time, I know I'm in trouble. I know that if I'm sitting down to do my charting at 2 o'clock, it's been a bad day. But some days are like that, no matter how efficient you are. So let's go on and look at a specific perfect time grid that, of course, will work perfectly. Here is the top part of that handout that I gave you that's attached. This is the time management student workshop. Basically what we're going to do is you need to identify the tasks for your patients. And so I gave you some ideas there of different things that we might have to do for our patients. And then what I have you do in the top part is just list all the different possible tasks that could happen, and then identify them specifically for your patient. So now let's go to the next slide, and we're going to talk about what all the things that we could possibly do. And if I was in a classroom with you, you'd be yelling out these ideas. I'd be throwing them up on the chalkboard, but we don't have that environment here, but we will recreate it on the PowerPoint. So, clinical tasks. What things do we do each day as a nurse? And the way I kind of do it, just like I do my head-to-toe assessment, it makes it easier if I just go from the top to the bottom. Then I'm not going to miss anything. I'm not going back and forth, back and forth. Some nurses like to do their assessment that way. I can't. I need to go in a logical fashion. I kind of do the same thing with my clinical tasks in a day. I think about when I walk onto the floor, what do I have to do? Now, here you are. You've gotten through your first semester of nursing, and so you know some of the things that you need to do. So when you walk on the floor, what's one thing that you might do? And I decided that one of you yelled out, review the chart. Of course, we always need to look at the chart to see if what we saw the night before still is the same. Certainly, we still want to make sure our patient is even still here. The other things that we want to do is, of course, even if we weren't doing a search the night before, we would have to come in and look at our chart. Another thing that we do have to do is get report from the RN and the ACT. I say both of them because, especially as student nurses, we need to connect with our RN to get the information that's current, but we also need to get together with our ACT so that they know that we're doing the morning care, so that they don't go ahead and do the morning care, the oral care, the bath, the linen change, the walking, the breakfast, the meals, everything, all those things. We want to do them. And the reason that we want you to do this is, especially me, I want you to do this is because I want you to learn to be able to handle 2 patients completely. And that is with everything that's involved. Everything that the RN and the ACT would be doing for those 2 patients, you would be doing for that. And that will give you a glimpse of what it will be like when you have 4 or 5 patients as an RN. And so that's what I'm trying to do, is create that so that you and I can work on your time management and get all the things in place that will make you more effective. What else are we going to do besides getting report from them? We need to do a physical assessment. And that's what I think about. I come on the floor, I get report. Usually the nurse isn't really available, so I look at the chart. Then I go in and I get my patient's assessment. At the same time, I always go ahead and get my vital signs. When we talk later, we'll talk about these things are done at the same time, so just do them at the same time. Other things that we might do after that, of course, the time is going by very quickly by now because report always seems to take so long. But other things that would happen is maybe we need to do some kind of a treatment, and the one that I'm thinking of predominantly is our blood glucoses that we have to do. We need to check and make sure that their blood glucose is okay, and we may have to intervene with some insulin. I also added here dressings because I was talking about treatments. What are all the different things that we might have to do for our patient? You know, there might be a variety of specific things that might need to be done for our patient under the treatment area. And so this is very individual. Other things that we might need to do for our patients are breakfast and lunch. Yes, we need to give them meals. And some patients, we may have to feed them. We may have to set it all up for them. They're not able to eat it on their own. AM labs. This is something that as first semester students, you are probably used to eventually getting to the AM labs and looking at them, but most predominantly you looked at them the night before. One thing that's different about second semester is when we come on the floor, many of the meds that we give are on a sliding scale, and they're based on the lab value for that morning. So the ones that I'm going to put right off the top of my head, potassium, magnesium, and phosphorus are the three biggies that we will intervene with some kind of either oral or IV medication if they are low. And not even if they're low, if they are normal on the low side, we may intervene. So you need to look at your medications that are PRN the night before during search and see about that potassium, magnesium, phosphorus, and see the sliding scale and know what those sliding scales are. And in the morning when the lab work comes back, usually around 9 o'clock, sometimes we get lucky and it's earlier, but I try to look around 9, worst case scenario 10, we will see these AM labs and we will intervene with some kind of medication if they are if they require something. Other things that we need to do for our patients: oral hygiene, morning care, bath, linen change. Many times I'll do these all together. Some patients like to have their oral hygiene done before breakfast. Some like it afterwards. Some people want to have a shower. Some patients can't get out of bed, and so you're going to have to do a linen change in the bed. Some of them are required to get up and walk 3 times a day, and so during that time you can get a linen change. And so all these things I tend to group together. Activity is another one that I'll look at. Are they able to get up? Do they need to get up? Does it say up in the chair 3 times a day? Does it say ambulate 3 times a day, 4 times a day? If this is true, I need to incorporate this in my morning care and get this patient up. And this is especially true of our perioperative patients that need to be ambulated so that we can prevent all the array of complications that can occur from patients postoperatively. Another one is medications. I'm sure you were thinking of that right off the bat because medications are a really important one, and it's really a time-specific sort of activity. And those, especially with the IV meds, can be happening all day long. Documentation we need to get done. And for second semester, typically what I require you to document is I require you to document your vital signs in the Cerner. I require that you do ADLs, which is all that information there under iView related to bath and Braden score and all that, activity, meals. It's all under ADLs. And then also patient education. Under Cerner Train, which we'll talk about during orientation, I'll have you do your physical assessment and your IV assessment. And so don't worry about that right now. I'll show you how to do that and help you with that the first week. Other things is education. Always we educate. In fact, education is something that I don't give it a time because it's all the time. Every time I'm working with my patient and I see that they don't get something, or maybe it's new to them, or even if I'm just reinforcing, I'm always educating, making sure they're safe and they understand what's going on for them. So education is just ongoing. I don't even put a time for it. Breaks, oh yes, nice for us to take a break, hey? It seems like more and more it's harder to get a break, but I really want to encourage you as new nurses that you need to take your breaks. I think that when I came up from nursing school, it was a time-honored tradition that you're tough and you could go the whole shift without taking a bathroom break or a meal break or throw the food in your mouth as you're running from one thing to another. But this is not really healthy behavior, and I don't encourage you to do this. And if you see me do that, remember, I don't think this is a good idea. Problem is, we don't have break nurses for student nurses and for faculty, but we do need to get to lunch. We need to bring food with us so that we don't end up flat on the floor because we're just worn out and our blood sugar is so low. Other things that we need to do is we need to report off to RN and the ACT. So when we're ready to leave, we need to tell them what happened, what's been done, and what still needs to be done. So this is just a composite of some things that you would throw out to me and say, these are things that we do, things that we've got to do. And you might even come up with some more, and certainly, each patient has some extra things that could be added on here. Let's say they might be having dialysis, or they might be going down for a PICC line. So this changes everything as the day flows. Okay, so here now what I've done is I've taken these activities, and now we're going to talk about what time do these activities. So I have you list all the activities that could possibly happen for your patients, and then we talk about what's the typical time that we would see these patients when we would do these things. Or is there a specific time that we must do it? Sometimes yes, sometimes no. So let's look at the next slide and talk about those times. So let's look at review chart. Review chart, you got to look at the chart before you come on the floor, before you start taking care of the patient. So I put that as 7 o'clock. When we get report from our RNs and ACTs, that's got to be right up at the front too, and we want that to be as close to 7 o'clock as possible. Unfortunately, sometimes your RN from night shift doesn't get to the day shift nurse for quite a while, and sometimes this can push down to 7:45, and boy, does that make it difficult to get the next thing done, which is your assessment and your vital signs. And your assessment and your vital signs need to be completed by 8 o'clock. I use that as the time frame that if I have not done all my assessments with vital signs and blood sugars before 8 o'clock, I'm running behind. So that is a time that I put on in my mind to tell myself if I'm doing well or not. And this is a tight one, especially in that first hour. There's a lot to do in that first hour, and you can see why the nurses are always so overly stressed when you come on the floor, because when you walk on the floor at 7 o'clock and you see you have 4 or 5 patients, and let's say they're heavy patients, and then you have a couple student nurses with you, and then you have a faculty person running around, and then you have a patient complaining about this, you sit there and you go, how am I going to accomplish this? And you may not say that, but mentally you start getting so emotionally, you get so stressed that's why sometimes the nurses can come off as being so cranky, and we just need to be respectful of that even we get a little cranky and stressed in that first hour, and just have to breathe on through it. What about dressings? Dressings, well, I like to do my dressings from the 10 to 11 o'clock time. That's my time frame that I like to get them done. But dressings, honestly, do not need to be done they're not really time specific unless they are ordered like every 4 hours or every 6 hours, every 8 hours. But that's unusual. Most dressings are every day. So we have a little bit of time here, a little bit of leeway. Blood glucoses, though, are very time specific. Those are 7:30 and 11 o'clock, 11:30 for some floors, depending on when your lunch trays come on the floor. On the pavilions, our lunch trays are typically there around 11:30, so I like you to start getting your blood glucoses around 11 o'clock. Breakfast typically comes at 8 o'clock on our floors, and as I said before, the lunches are at 11:30. So we've got some times that we're slotting in here. Because nobody likes to have their meal cold. I mean, it certainly can sit there in the tray, in the cart, but you know what? it's no fun when it's cold, and it's no fun for us to have to go back and heat them up or reorder the tray. So try and keep that in mind, that those times are pretty firm. AM labs I talked to you about before that we cover for the sliding scale on those, so we need to look at those AM labs, and I usually put it down for around 9 o'clock, 10 o'clock at the latest. I would recommend, as you're getting ready to go do your 9 o'clocks, that you look at those AM labs before you take the computer with us to go and give meds. Oral hygiene, bath, that is very individual. It depends on the patient. Some patients like to sleep in, some like to get up and get going. I encourage my patients to always have oral hygiene and bath every single day. I set it up. I don't ask them if they want it. I pretty much tell them they're going to have it. I don't mean to say it in that non-TPC sort of way, but they need to feel clean, and it's part of good health. And it's just a basic thing, and we need to do this. So oral hygiene, I just set up the stuff for them and let them give themselves their bath and their oral hygiene, and then I clean up after them, and I get whatever part they're not able to reach. And some of them can reach a lot, and some can't reach very much at all. So it all depends. So when I look at my patients, that's another thing that I utilize in trying to plan my day. How much assistance do they need? And then linen change, I try to do the linen change when I get them up in the chair. When I get them up in the chair, I change the bed, and if they can stay up and go walking, that's perfect. If they can't, then I get them back to bed. Medications are always, we always have 9 o'clocks, and you'll notice with the IV meds we even have more than that, but typically we can always plan on 9 o'clock meds. Documentation, I like everything to be documented by 11 o'clock. But you know what? Documentation can be done anytime. Sometimes, certainly as an experienced nurse, I've been at the end of my shift documenting for the entire day. That is not good, but it is sometimes the way it is. So that's why I have a very good cheat sheet that I always keep all my information on, so that there is no way that I'm missing the data. Now at Tri-City, the medications are documented automatically with the Tough Book. So that makes life simple. And so the things that need to be charted are the vital signs and the assessment. They don't want us to chart it there at Cerner, so we're doing it in Cerner Train. So I try and mimic similar to what they would want it. They like it charted within 4 hours of you doing it. So I have 11 o'clock as the deadline for you to get your assessments in. The rest of the stuff you have till 2 o'clock, which is, or 1400. So vital signs, ADLs, patient education, all that stuff can go in there. I typically, in the way that I've always cared for patients, I always try and sit down around 10:30 and get all my charting done, and then I come back in later in the day to add. Education, like I said, is ongoing. Break, we got to grab a break somewhere along the line. Typically, most of us take it around 12:30. And then, of course, you have to report off to your RN and ACT. No, it should be off to your RN ACT, and that's at 2 o'clock. So here is the handout, the bottom half of that handout, showing you the times, the patients, and taking those tasks and slotting them into the specific times. So we're going to take those tasks that are time specific, such as medications, blood glucoses, assessment, report, all those, and we're going to slot those into the times where they have no leeway. They have to be at that time. Then we're going to see where we have some blanks that are going to create, and that will help us to slot in those things that are a little bit more flexible, like the morning care and the dressing, and that will help us to make a plan for the day. The thing that's about nursing is that there's always something to do. And we do have to be very flexible because things change every day. We go onto the floor and our patient has diarrhea and they're in the bathroom all morning, and we can't do any of the things that we normally would want to do. So then we have to go and do the other tasks that we know still have to be done. We just have to be flexible, and the best laid plans will go awry, and this is just a template. So let's go ahead and look at a grid that might actually occur. So here is a time grid that I created with patient number 1 and patient number 2. And you can see that what I did is I wrote in, here we are at 6:45. I've come onto the floor. This is typically when we get on the floor. And I'm looking at my chart for both of my patients. This is a good time also to print anything that you need to print. Now we are getting more and more away from paper, and we don't print our task lists like we used to. We go off of the Tough book, and that is your little tablet that we take into the room. And so we're getting more and more working that way. And in fact, I think we're going to be at a point where they're not going to allow us to have those task lists anymore. But right now we have the opportunity for both. So print whatever you need. Just be frugal because it is Tri-Cities paper and not ours. At 7 o'clock, usually the nurses are there and I'm going to get report. Sometimes I can talk to my ACTs ahead of time, but I have to do this for both patients. This is where the time element issues come in. You'll see at 7:30 or hopefully sooner, hopefully like life would be so grand if at 7:15 I'm actually going into my first patient's room and doing my assessment and my vital signs, and my blood glucose is going to be for one of them. The other one I just have assessment and vital signs. So this is why when we talk to you about your assessment that you need to be able to do a head-to-toe assessment in 5 minutes. 10 minutes max, and that is because you're not going to be able to take care of 4 to 5 patients and get your assessment done for all of them and be done by 8 o'clock. So this is something that if you're struggling with, and everybody struggles with something. If you are struggling in this area, please go to Skills Lab or just practice at home on one of your family members. Certainly my family members had to go through all this on how to do a head-to-toe assessment in 5 to 10 minutes. Now remember, what you learned as a head-to-toe assessment in semester 1 is a comprehensive one. Some patients don't need a comprehensive head-to-toe assessment. If they do not have any neurological problems, you do not have to do all the things that you learned. So you do a head-to-toe assessment on the vital areas and you focus in on the areas that are of concern, or if anything that you see abnormal with your patient would trigger you to go more focused. Then going on, by 8 o'clock, hopefully you should have your assessment, vital signs, blood glucose done, so that at that time we can put the breakfast trays in the room and follow up with any insulin if necessary. Morning care, you'll see I denoted for the patient number 1, go ahead and do his or her morning care and activity, get them all done. And all I did with patient number 2 is let them eat breakfast. And one thing I do try and do is tell my patients what I'm doing so that they don't think I'm just off eating donuts down in the nurse's lounge, although I wish I was. But anyways, at 9 o'clock we go for medications, hopefully earlier. And then as a result, I'm able to go over and do morning care with the other patient. Hopefully by 10 o'clock I can sit down and do my charting. That's also a period of time where I like to do dressings. And then here we come into 11 o'clock. I want to get my blood glucose, cover it with any insulin, and set up for lunch for both of my patients. And then hopefully, I'm always hopeful that by 12:15, 12:30, I am making it for lunch. If I am at 12:45, I know I'm in trouble. I'm having problems. If I sit down to chart and it's 12 o'clock, I know I'm in trouble. If I'm still doing morning care by 11:30, I know I'm in trouble. So these are timelines that just help me to know, wow, I'm running behind. Especially someone like me who likes to talk a lot. Yes, you'll learn. It's easy for me to start talking with the patients and doing a lot of things, talking to them. And sometimes I have to really watch the time so that I don't get too involved, and I have to set boundaries with myself and my patient. Charting, come back after lunch and I check all my charts, make sure everything's up to date, and hopefully Usually we'll have meds that we still have to give. The IV meds seem to go all day, as I said before. And then finally at 1400, 2 o'clock, I'm going to report off to my RN and my ACT, telling my RN what I've done for the day, what needs to be done, and my ACT just verifying that I'm no longer on the floor, that she'll need to or he will need to keep track of that patient. So this is kind of the way I would run my day. Let's say that with patient number 1, that at 9 o'clock, well, let's do it 8 o'clock. 8 o'clock, my patient is, all of a sudden they've decided to do a PICC line on this patient. So they're taking my patient down to intervention radiology. And now, what do? Well, now I slot right over to patient 2, and I'm going to do the morning care and activity there, so that when that patient comes back from PICC line, I can do morning care with that patient. Now maybe when they come back at 9 o'clock, they're too tired, they don't want to be messed with. Leave me alone is what they're saying. So then what am I going to do? Well, I do know that I have to do a dressing change with them. So it's just easier to do it all at one time. So I negotiate with my patient and say, okay, well at 10 o'clock I need to do your dressing change. So how about at 10 o'clock I'll come in and I will give you we'll get your bath done and we'll do your dressing change all at the same time. How about that? So these are things that, especially the more life experiences you have and the more you hear how other nurses word things, will help you on how to handle your patients. So there's some more tips. Efficiency of movement. What I like to do, the way I would do when I would take care of patients. Now, when I took care of patients, they were doing primary care. We also did team nursing. I've been a nurse a long time, so I've seen a lot of different types of nursing management styles. The last one that I did was primary care on the floor with 5 patients each, no CNA or ACT. And so that required quite a bit of management to be able to handle that many patients. I saw many nurses not take care of their patients. They just would pretend that they had given them a bath, but they really hadn't. And I think that's deplorable. I'm thankful that we have our ACTs. I've worked with ACTs where we've done the team model, where I had the same ACT for all my patients, and then we rotated each month, have a different ACT. I really liked doing that. That worked really well because you get a real teamwork going on. Right now, you're all over the place, and so it's a little different, and the ACT does the primary bedside care. But you need to know how to do this, especially because we're trying to mimic what it will be like when you have 4 patients. So, efficiency of movement. What I used to do is I'd bring all my supplies into all the rooms at one time. So I would load up a cart, and I would go down each room, and I'd put in the amount of supplies that I needed for each room. You need to be very careful, though. Do not waste supplies. Do not bring supplies into the room that you may not use. So I would bring my supplies in. So if I had an NG tube, I knew that I needed certain things in there, especially since I'm a messy nurse. I'd need more towels, and I'd need some cups, and I'd need some medicine cups and some spoons, and I would need the irrigation tray. And so certain things I would know looking at my patient to supply in, and I put them all in the beginning of the day. I would also group all my activities. Whatever I could do together, I would group together, such as when I said to you about the bath and the dressing together. Sometimes that's appropriate, especially if you're turning your patient over, cleaning up their rear end. Let's go ahead and do that sacral dressing change at the same time. Or I always do my vital signs and my assessment together and my blood sugar. I like to inform my patient of their schedule, of my schedule, so that they know what's going on. They don't think I'm just deserting them. So I'll say, here, I'm going to set up your bath right now. Here's all your stuff. Put on your light when you're finished. I'll be keeping an eye out for it because I'm going to sit down and do some charting outside the room. And as soon as you're done, I'll come in. So then I'll come in. The other thing I'll say is, well, I'm going to be next door with a patient because I'm going to give them their morning care, get them all cleaned up for the day. That'll probably take me about 15-30 minutes, and then I'll be back to you. So when you follow up on all these things, that helps with the patients. Sometimes, even as I work more and more, I'd say with patients, if if you don't see me back in 30 minutes, then that means that I've gotten diverted. So put your light on again. Because let's face it, I do forget. You get distracted in nursing. They pull you every which way. I encourage the patient to be independent as well. So if a patient can give themselves a bath, I let them give themselves a bath. I set it up and I force them in a nice way. But I pretty much set it all up and say, now you bathe everything you can, and I'll come back. When you're finished, I'll come back and I'll do whatever you couldn't get. And that makes them be more independent. And it also gives you a little bit of time to maybe go set up another patient, and they can get started, and then you come back to the other one, finish up, do their back, their rear end, their feet, and give them a fresh new gown, and you're done for the day for that patient. Or, well, I'm really overstating it, saying you're done for the day. But anyways, another thing is ask for help. If you're getting behind, ask someone to help you. That's why we have students on the floor. You have other peers that you can work with. You have me. You have the ACTs. You have the nurses. You know what? Ask for help if you're in trouble. And then have an effective cheat sheet and use it. So you need a cheat sheet that works for you. I know that you have one from first semester that was a template that helps you get going, but all of us take care of our information in different ways, and so try and create something that will work for you. And also, I always have a section on my cheat sheet that I can note any outstanding task and any concerns, so that if the doctor comes in, I can look straight to that box and say, I was wondering about this, I was wondering about that. Or if I come back from lunch, what things are outstanding so that I can still work on those. Because sometimes, they weren't able to take a medication and I need to come back and give it to them later. So here, underneath all this, you're going to be a superhero here. I thought this was cute, the little superhero. And you'll figure this out. It just takes time. It doesn't happen right away. If this is something that is your flaw, I put that in quotes, then let's work on it. This is one of my stronger suits and something that I'm stronger in. But there's other things that I'm not. And so I always have to work on those. And so together we can figure out the most efficient way to accomplish this and give our patients the best care that they deserve, the best safe, quality care, with all the other things that we want to give them, the education, the compassion, the nurturing, and all the things that we went into nursing for. So the more efficient we can be in the things that we have to do and that are time sensitive, the more likely we can do the things that make us happy as nurses and make our patients happy as well. Thank you for listening to this PowerPoint, and I hope that it helps you. And I will see you when you come into our next semester. I look forward to working with you.